You're listening to Random Fit with hosts Wendy Batts and Ken Miller, winner of a Gold Markham Award for Digital Media.
Hi, everyone. Welcome to this week's episode of Random Fit. I am Wendy Batts here with my friend and co-host, Ken Miller. Ken, how are you?
I'm awesome, Wendy. How you doing? You're looking good.
I am so good and really excited about today's topic. We do have a very special guest. So do you want to go ahead and introduce her so we can bring her on?
Yes. On this episode of Random Fit, we're going to bring on Miss Jiji Pollack, who great presenter, great practitioner. She works along with a previous guest of ours with Institute of Motion. She's going for a PhD, and she is a professor at university. So let's go and bring on Miss Jiji Pollack.
Hi, Jiji.
Hi. Thank you for having me.
Oh, thank you for being here.
Pleasure, yeah.
I'm going to go ahead and kick off the first question. So, Jiji, I know that you specialize a lot, especially with females and the hips. And I get a ton of questions from my friends, my coworkers, along with, clients who always ask, is there a big difference between a man's body and a woman's body without it being just the obvious, especially when it comes to working out. And it really does revolve around the hips. So can you kind of tell us the difference, please?
Okay, so first of all, women have wider hips in general. And that leads to structure and function. And then within the female hip, there are 4 different types of hips. So I can go through the anatomical differences if that's what you'd like to hear, such as a wider false pelvis, right? And then the true pelvis is where that hosts the organs is actually shallower for females. And the reason being is for childbirth, right? There are other things that are different, such as I wrote some notes here, like the pubic angle is a lot wider in females compared to males. And it is more V-shaped in males. And I don't want to say it's more W-shaped than females, but it is a lot wider. Also, a female's hips are more oval, where a male's hips are more heart-shaped. And then the hip sockets, are a lot shallower in females. So that's in structure, that is the main difference in males and females. And then also, I'm looking here so I don't forget my talking points. Within the female hip, we actually go through a lot of structural changes throughout a lifetime, whereas males really do not go as many structural changes. For example, a young girl will start with narrow hips, and then when she enters puberty, what's called the Tanner stages, her hips start to widen, and all the bones change and grow at different rates, which affects the way she moves. And then if a woman decides to have a baby during those bearing years, they go from getting wider to trying to go back to getting narrower, right, in the postpartum phase. And then, interestingly enough, there's a lot of physiological changes that happen throughout the menstrual cycle and throughout, pregnancy and postpartum that affect the hip. And then menopausal changes happen with the physiology that affect the hip, the hip sockets and the hip joint that predispose women to a lot more maladies in the hip. And then also, it's interesting how post-menopause, a female's hip just becomes narrower, much like a man's, but still a little bit wider. So there's a lot going on in the female hip.
Yeah.
Yeah.
I mean, and getting you on Random Fit today, talking about building unbreakable hips. That was the title of the presentation that you did recently in Anaheim, in Los Angeles. Sorry, same general area.
Exactly.
But very much personal and selfish reasons I wanted to have you on board, because in that presentation, you talked about just what you talked about right now with the anatomy of the hips, and Q angle is something that comes up a lot when it comes to personal training and how we would work with a female, as far as addressing their specific structures. Can you tell us more about the importance of understanding the Q angle and what that does mean, if you're able to observe differences between one person to the next as far as that specific term? Because it's something that gets brought up to me, and I just
Mhm.
want for us to understand what the Q angle is and what it means as far as how do we address that.
So first of all, the Q angle is defined as the area that the line that comes from the patellar tendon up to the quadricep tendon. And the wider a female's hips are, the greater the Q angle. And the greater the Q angle, the greater amount of, I guess, sheer force can happen to a female if she were to do cutting maneuvers. So she is more susceptible to knee injury, ACL injury, with a greater Q angle. And I'm going to say that with an asterisk, because although a female has a greater Q angle, I mean, that predisposes her to greater ACL injury, but it also depends on the type of training that she's doing, right? So that can be prevented, and strengthening those muscles that help stabilize the knee, the hip, the strengthening the muscles that cross the hip and knee joint in itself.
So Gigi, I have a question, because when you were talking about the differences, obviously, and the changes that our lovely hips have to go through throughout our lives, obviously menopause is a big thing that happens towards the end. I don't want to say the end of our life, because again, I'm probably almost towards that stage and I have a lot of life left. However,
For sure.
when we are going through the menstrual cycle, starting, at the ages of anywhere from 14 to 16, depending on the female, when you're working out, that can obviously change just for that short period in a week. So can you kind of talk us through what's happening, especially at the hips during that time of the month for us?
Well, I think we talk about anatomy and we talk about muscles, but I think what sometimes we forget is how much the physiology, the chemistry of the body really affects the tendons, the muscles, the ligaments, and the bone structure. So that's the first and foremost thing. So throughout the menstrual cycle, there are undulations of, I'm going to speak specifically of estrogen and progesterone, and how those changes can affect the hip. For example, in the first phase of the menstrual cycle, when estrogen is lowest and progesterone is still low, but higher compared to estrogen, there are physiological changes that are driven by those hormones. Estrogen is considered an antioxidant, so it helps, has been shown in studies, to help with recovery methods, recovery of the muscles and tissues. Progesterone, interestingly enough, has been correlated with higher rates of cortisol levels and higher rates of pro-inflammatory substance. So you take a little bit higher cortisol, lower estrogen, and then the chemistry within the hip changes itself. So there's an increased amount of pro-inflammatory substances that drive the signaling of other substances that increase pain in the hip. Prostaglandins are huge, and they're pain-producing substances that happen in the hip and can lead to menstrual cramps. They can lead to hip pain. They can lead to muscle aches. So I think it's important to realize that these things happen in a woman's body, and they're not phantom feelings. So within that, so I'm just talking about the first few days of the menstrual cycle, which is our days 1 through 7, depending on the female. It could be 1 through 4 when those levels are lower. I'm going to go back a little bit to the premenstrual phase, which are considered days anywhere between days 21 to 28, right before a female gets her period. So during that phase, estrogen is starting to dip, but there are peak levels of progesterone. And as I said earlier, peak levels of progesterone are correlated with higher levels of cortisol, which increase the signaling of pro-inflammatory substances, which then again increase the signaling of, pain substances. So there's a reason a woman gets PMS symptoms such as edema, more muscle cramps, food cravings, because there's a lot of things that happen within the changes in physiology due to the hormones. It's such a rabbit hole, I have to say.
Yeah. I just remember during your presentation, you went into the cycle and you had the charts and explaining the effects over that month. But the one thing, as a male trainer I work with females from junior high into the active aging 65 plus. So to the points that you bring up, one of the things that I'm getting more comfortable, and I've been doing this for more than a few years now, as far as addressing, okay, where are we in the menstrual cycle? Not we, but where are you in your menstrual
You
cycle?
can say we, it's okay.
Yeah, well, us,
Empathy.
because we're in the same room.
Yeah.
But how does that affect the training session? So just generally, if I understand that, okay, we're within that time frame where someone's experiencing cramps, what other considerations should I keep in mind when it comes to our training session, outside of the fact that you might be a little uncomfortable with cramps? But how should the workout reflect your current physiological state? Because when you talk about laxity, joint laxity, and stability through the joints, what are some of the considerations that a fitness professional needs to consider when training somebody during that cycle?
During PMS and during
PMS, all of that,
during the heightened amounts of, I guess, physiological stress. So one thing that's also to keep in mind, and you explained, you talked about joint laxity. I think that's not commonly thought of sometimes. It's interesting that all these hormones peak at different levels, right? And then it's interesting how joint laxity increases right around the PMS phase, like days 21 to 28, depending on the female, right? It peaks. There's a hormone called relaxin, and relaxin loosens up the joints. The body is so smart, right? So right after progesterone peaks, relaxin also peaks to loosen up the ligaments and joints. So that's something to keep in mind when a female is being trained. And I think what's also not commonly known is that increased levels of relaxin also increase levels of a substance that degenerates the cartilage, right? So if you're adding a lot of intensity and that cartilage is getting degenerated, that called collagenase, then you might want to think about how to modify that intensity relative to how that female is feeling. And keep in mind also, not all females feel that way. Although 80% do, there are the lucky 20% that don't feel that, right? So it's important to think about that intensity relative to where that female is in that cycle. I mean, we always, talk about meeting your client where they're at, right, in order to produce a good session for them. I think that's a huge thing to keep in mind during that time.
Yeah, I mean, it's just the evolution of the conversation when it comes to my female clients, because I don't know if I don't want to say I've got them trained, but now they know that, if it's the night before or leading up to our training session, they'll message me and say, hey, I started my period yesterday, right? So that
that's so awesome.
Yeah, so now when we train, it's a matter of, okay, well, we're not going to do muscular development. We're not going to do power that day, but let's work on more stability, some more strength endurance or stability endurance that day, just to accommodate for, well, I don't want, heavy explosive jumps, depth jumps, heavy weights and things like that at a time where you're least likely to, able to stabilize over that time frame. So thanks for that.
Smart. No, that's smart. And also I think something to keep in mind when you're thinking about that is also, it may be tougher to recover for that female during that. So after, if you do decide to do an intense session, say because of, programming needs or where she is in her season, right? It's important to keep in mind that recovery is going to be maybe more compromised during that time because of the low levels of hormones, right? So I think it's smart to have them, let you know if they've started their period, if they're PMSing, because a lot of coaches don't do that. So it sets them up for success later on in life. So that's so cool. I think that's so cool.
And well, today on Random Fit, myself, Wendy Batts, is here with my co-host Ken Miller, and we have a very special guest. We have Jiji Pollack joining us, and we are talking about the building unbreakable hips. Right now, we are getting into the menstrual cycle and what's happening with female bodies. Those men listening need to pay close attention because it really is a thing. But Jiji, I have a question too, because I have sat into a bunch of different sessions, and with you being a female trainer as well as myself, and getting into roundtables and people talking as a coach. So if you're a female coach, or if you're a male coach needing female advice, and you have a team of 15 to 20 girls, and it doesn't matter if they're lacrosse or cross country swimmers, whatever the case may be. Obviously, they say when you hang around together, maybe you'll start at the same time, but that's obviously not always the case. So what's your advice to a coach who is working with female teams or doing boot camps if they're a trainer, because everyone's different? So what would your suggestion be for that?
I know it's hard to customize if you're doing, a group, right? And, if they're playing a sport and depending on their season, right, you're going to have an intense period and then a less intense period, depending when they're in a season and depending on their sport. Or I think it's important to have that person communicate with you. That's going to be huge, as to hopefully they feel comfortable as to where they are that day. And, there are a lot of studies that show that females have a difficult time communicating their experience, particularly with male coaches, and they're less likely to communicate with male coaches compared to female coaches, which makes sense, right? There are a lot of cultural issues, and personalities that have to do with that, right? And how the menstrual cycle is introduced to that female. So that has to do with how, they're able to communicate that. But if they are in a group setting, it's important to keep those lines of communication open with that individual. And then, don't be afraid to modify that intensity and tell that client, or that person, it's okay not to be as intense as compared to other females. Or if there's something you can regress, that day for that female, and let them know it's okay. Particularly if they have that athletic mindset, that's sometimes hard to turn off, and they just kind of want to, perform as well as the others and push themselves, right? But understanding that's okay to be less intense and still do the workout is really important to communicate, I think.
Well, and I'm going to throw this out there. So if anyone's listening, when we were on this roundtable, one suggestion that we've had, and when I used to work mainly with females, we were working a lot with female Olympic pole vaulters. They were older, so they were very open, and I'm a female. However, when they went to their male coaches, one suggestion that we made that actually worked. So if you guys are listening and thinking, what am I going to do? And I have a bunch of, younger children or kids that do not feel comfortable, is you can buy really cute bracelets, like jelly bracelets or something. And there's a specific color that they'll wear that day when they're on their period. So if they don't feel like open communication and they can't talk to their coach, or they're embarrassed about it, they just wear that bracelet. Everybody on the team knows what the color means, but other people around them don't. And it allows the coach to see, oh, hey, the woman's accessorizing. However, I know what that means. And so it was a good suggestion that was made. We've done it, and it worked out great, especially with our high school athletes. So I just wanted to throw that out there that, I think Andy Hanley, who is also one of our master instructors, he does that as well. And when he made that suggestion, I had heard it from other people, and it really does work, and it allows people to be more open-minded.
That is so smart. That is brilliant. So I've
All
never
about
heard
the
of that.
accessories, girl.
Yeah, no, exactly. I love
Forget the
it.
hips. It's all about the bracelets.
Exactly.
All right, now I got to go to Pinterest and look up the
Goodbye.
type of bracelet. There you go.
You could
Here's
do.
put this
That
on when
is
you
a
need to.
great
One's for
idea.
moody,
No,
one's for being on a period, one's having a great day.
I love it. I love it.
So
That is
let's,
so
you
smart.
know, again, you did a great job. Again, I can't talk about your presentation enough.
Thank you.
But the one thing that you broke down the hormonal fluctuations over the month, the different shapes of the pelvis, but with the science there's always going to be myths that fitness professionals, especially academics and professors like yourself, Jiji, that you're always, I'm sure you have your list of frequently asked questions that you're like, no, that's not exactly true. So when it comes to the resistance training part, again, you had a great workout. Again, male or female, the workout that you did with the Viper Pros as a group was awesome, and I felt my hips moving in ways that I don't usually challenge them in the gym. But what are some of the myths that we need to have a better grasp on when it comes to resistance training and the female?
Okay, so first of all, I think this is the biggest myth in females and why they don't want resistance train or weight train is that they're going to bulk up like men. I don't want to be bulky. I've heard that through many
Right.
many years, and there are a lot of I'm going to say old school women my age, right, who still believe that. And I think I'm glad that it's changing to see more and more young women starting to resistance train, that you will not bulk up because first of all, within the physiology of women, we don't have the same amount of testosterone as men to produce that amount of hypertrophy. So we have like 1/10 to 1/15 of that of men. So we will never. I don't like use superlatives because there are some very strong women out there, that. But we will not bulk up as much as men. Caveat is there are some women with PCOS who have higher amounts of testosterone, right? But yet, it's still less compared to men. Another thing to keep in mind is, when we resistance train, women produce, everyone produces growth hormone. Interesting enough, there's a lot of studies that show that growth hormone is more effective in women when there are higher levels of estrogen. So it is interesting to know that hypertrophy doesn't happen at the same rate when estrogen levels are lower. So I don't want to say, well, what's the point, right? So doing different types of workouts during lower levels of estrogen are okay, not to produce that growth hormone. So that is a huge misconception in women that they're going to bulk up as much. Second of all, that it's okay to feel less strong in certain workouts. I think in general, women compare themselves to other females, right? Why am I not as strong? Why am I not able to lift as much? Well, if you're in a different phase of your menstrual cycle, estrogen is interesting because it helps with the, if I'm going to go geek out, actin myosin chains. So it helps produce that contraction, muscle contraction. So if there are lower levels of estrogen, that muscular contraction is not going to be as strong because of the way estrogen acts on regulating the amount of calcium that's released to produce that actin myosin contraction. Interestingly enough, estrogen really acts directly on that heavy chain of myosin. So if you have lower levels of estrogen, you're not going to feel as strong. So it's okay to feel less strong during certain workouts. So give yourself that permission to maybe go lighter or, do less reps or do higher, So that, those are the, I think, two greatest ones. And then the other one is allow yourself a good amount of recovery, especially when there are lower levels of estrogen, or promote other recovery schemes that help, during those levels of low estrogen.
So what kind of schemes are you or would you recommend then? So outside of just take the day off. So what kind of recovery strategies would you have your clients do?
Nutrition is huge. I never underestimate the value of nutrition. Getting the right amount of protein, getting the right amount of fruits and vegetables for the antioxidants, because when you work out, right, you produce what's called reactive oxygen species. So those are things that promote degeneration of the muscle. So getting enough fruits and vegetables that have a lot of antioxidant properties are going to be really important, and getting amount of protein to help that recovery of the muscle. That's the best and easiest way to recover. And it's not, I think, thought of enough. I mean, there's other things you can do, like besides take the day off, like, go in the water and, get rid of the edema and walk in the water, red light therapy, massage. But really nutrition is the biggest and most low-tech way to promote that recovery. So.
I love it. And on Random Fit today, we're talking about building unbreakable hips with myself, Wendy Batts, and Ken Miller. And we have a special guest, Jiji Pollack. And Jiji, you've talked to us about so much great information. And I actually, because I could keep you here all day, just, geeking out, as you say, being a female, with all the questions that I get. However, I think my final question that I have for you is, what are the top 3 things that women should be doing to make their hips unbreakable?
Top 3 things. Actually, I thought of 4.
Give me 4, sister.
Okay, sorry.
That's
the
okay.
4th one. I'm gonna start with the 4th one. Move. You gotta move, because if you're not moving your hips, man, it's just not gonna work your way, because other things are affected. The hip helps translate so many movement patterns. You can't move without your hips. So move so that you don't feel like you're creaky. Second of all is move in different planes of motion with load. I love moving in a sagittal plane. They're very effective, but moving in a transverse plane, is really important for the hips to help move the musculature, and also because of what it does to the pelvic floor muscles. Women are more predisposed to having weaker pelvic floor muscles. And also the other thing is work on your hip mobility. So I think that's going to be really important for females, and then work on good recovery schemes for the hip.
I love
Those
it.
are my top 4.
All right.
Hips don't lie, according to Shakira, guys. I'm telling you.
Well, exactly, they don't.
I know, right?
She knew what she was talking about when she wrote that song, because they really don't.
I cannot move my hips like that, and I would really like to see Ken try as well. That could maybe be a podcast in itself.
That's an art form in itself, moving your hips that way. So
no,
it actually comes from mid. Yeah. By the way, it actually comes that movement. I mean, although you need the hips, the mid back is, I heard that, because I have one of my children, I have 3 boys, and they're going to kill me, but one of them can move that way. He says, Mom, it's actually from the mid back. I'm like, oh, it is.
I wouldn't be able to walk for a couple days if I tried anything like that. But so let me ask you that, we mentioned earlier that, again, your relationship with the Institute of Motion, and you're an academic teaching multiple topics within the field of exercise science. So if anyone wanted to find out more information about what you just shared with us regarding females strength conditioning, the lifespan, and the different considerations, where would somebody go to find out more about what you have to teach?
As far as my teaching, well, I do have a program that runs under the Institute of Motion, under the AWHPS. It's another level 3 that talks about the hormonal patterns and what happens to the body, and how to program throughout the stages of a female's life. So I have that. The other things, there's a lot of great resources from academics themselves. One of my favorites are Stanford has what's called the FASTER program, FASTR. It's a female athlete translational research program. So what they do is they take the research and translate it for coaches. That's a great resource. There is also a lot of conferences, right, that I attend and go to kind of keep up to date on a lot of things. There's a conference that runs every other year called the Female Athlete Program. That's in Boston. That's a great one. It's they focus on female athletes, a lot of elite athletes, but those who are physically active are also supported in the research. And gosh, there's a book by Christine Yu called Up to Speed that talks a lot about the things that happen to the female body and the lag in research. And then, Jason Karp has a really good book that he put out called Run Like a Woman. So it's about endurance programming based on a menstrual cycle. That's a really good book. So those are some resources that I highly recommend for people to read. And gosh, there's, if I showed you my library of stuff that I have, I have a lot of books. So if they want some textbooks, they can also, feel free to find me on Twitter or, Instagram, Facebook. I'm on all those social media platforms that they can message me. And if they want some more information, because although I'm learning a lot, there's still so much more to learn. If you look at research, only sports and science literature have 39% of women as participants, but they don't always cover the female physiology, and about maybe 6% actually covers female physiology. And within that, there isn't a consistency in the way they are delineating the menstrual cycle or phases of actually menopause, because it takes about 5 to 10 years for that perimenopause period and another 10 years for that menopausal period, right? So it's a whole transition, and delineating when that female is going through is just a whole another science in itself. So yeah, I'm still learning as we go. And interestingly, I know, and I'm conducting a study actually at St. Mary's. I'm going to plug that in because I will be looking for moderately physically active participants in a menstrual cycle. So I might ping you guys to say, hey, I need some people to come see me at St. Mary's.
We'll see if we can do what we can to send you some subjects for that, especially if you're in the San Francisco, Oakland, East Bay area.
Yes, that'll happen about next
510-415. We'll see what we can do to help you out there. Because as you're saying, we need more studies done. So because the saying, the more you know, right?
Exactly. And this one is actually on resistance training and females. So we're going to look, resistance training and females. And we're actually using the delineation of the different ratios of estrogen and progesterone in the menstrual cycle to find out what is going on.
All right. Well,
when you figure it out, Jiji, I need you to let me know.
We're all still trying to figure it out. We're like, what is going on here? So trying to put adequate materials to find out.
Yeah, sounds like we've got a follow-up topic here, Wendy, Jiji.
Yes.
So we'll definitely keep in touch. So Jiji, thank you so much for all the information. I consider myself smarter now than I was 40 minutes ago. So thank you for that. And on behalf of Random Fit, thank you for being here. And hopefully our listeners got as much out of this episode as I did, as always. But we'll definitely have to have you back on. So for those of you that are listening to us here on Random Fit, thank you so much for your time. And hopefully, like I said, you took a little something away, especially when it comes to the female physiology and resistance training. So here we go. Like, follow, subscribe, download, share. Let us know what you want us to talk about, and we'll be sure to get that on Random Fit. So until next time, everybody, take care and be well.